characteristically has irritable mood. That's the one place in the DSM where we said, hey, we're not going to just copy the criteria from adult and paste it over for the pediatric population. We're actually going to say there can be this difference with this irritability and mood, right? And for kids, you're often seeing this withdrawal from school, from activities, problems with school performance, not getting out of bed and going to school, increasing isolation, lots of time on phones, social media, screens, that kind of thing. Right. And the coping strategies that adolescents can do are a lot different than adults, right? You cannot say, hey, I'm having a really tough go, let's go for a week to the Keys, right? You cannot, in many cases, say, hey, I'm having an awful experience at the school, this is bullying, borderline, illegal things that are being done to me, I need a different school. You often don't have the ability to even transport yourself to the things you'd want to do. Maybe you love doing, hot yoga, but the closest place is 5 miles away and your bike's not getting you there, and pretty hard to find a way to make that happen for a lot of kids across the country. And overall, as an adolescent, and again, I know you guys all know this probably even better than me, you lack control, right? So you're being placed with higher and higher expectations, higher and higher demands. You have to get ready to go out into the real world. You have to be doing X, Y, Z, but you don't have a lot of control, and it makes it a very challenging time when you're stacking depressive symptoms on top of that. So what do kids do that are having depressive symptoms? They're very characteristic in what they do. We see suicidal ideation very commonly in this age range. They're the second highest group of increased suicidal rates and unfortunately completions. We see a lot of self-injurious behavior where adolescents sometimes feel like they can feel something as a result of cutting, burning, hurting themselves. In some cases, they feel like they can channel what they're feeling into something physical, and it provides them a temporary relief. Many of the adolescents I work with, unfortunately, have self-injurious behavior really as a method to punish themselves, which is a self-reinforcing way of making depression worse. And then, honestly, one of the most common ways that all people deal with depression, unfortunately, especially in American society, is using substances, right? And these can help us feel numb, to relax, to feel like we're our old self, to forget about the fact that we're struggling with our mental health, difficulties here. People sometimes use this word self-medication in like a pejorative kind of way, but this is absolutely a thing that you see, on a regular basis. Anybody who does addictionology work, at any stage in the life cycle will see let's take a timeline of what happened. I was feeling really down. The one thing that made me feel better was getting high. Shockingly, they go and get high, more as a result of that. Right. And then, of course, in the work that we do here at SunCloud, we also see a lot of disordered eating to have control, feel like you're making progress at something or prove yourself through changes in your physical appearance.